time. And this is a modeled microwave radiation dose of a 6-year-old with greater levels to the frontal and temporal lobes, eyes and cheek. And watch this here. Now, yellow, white, and red are the hottest, all right? And if you look carefully, you will see it's going into the eye, the nose. Do it again, just so you'll get to see it. And partly into the brainstem. Now, that's just showing you that there's going to be some exposure into that area of a young head. It doesn't tell you that there's any biological effect, right? Now, the next slide is going to show you something that might be of interest to students and faculty here. And that has to do with exposure to the reproductive organs. We call them the gonads, I think you say the testicles, and bone marrow. And look here at the radiation as it gets into the groin area. And that's just from having a mobile phone modeled into the pocket. And this, again, is based on normalized SAR with I think we had a dipole antenna. And there are many different variables you can alter in coming up with this kind of simulation, right? The number of antenna, whether it's GSM, CDMA, whether it's simultaneously operating only one antenna or more than one. But we believe that this is the kind of work that needs to be done and that this institution might be in a position to do it. And my colleagues from Brazil would be happy to share with you the modeling that we have done to date to generate this. But based on this work and other studies that have been done around the world, the United States magazine Consumer Reports recently recommended that nobody keep a phone in their pocket. Nobody. And in fact, if phones were tested in pockets, they would exceed the as-tested exposure guidelines, which is why Telstra has recently issued that advice. Now, when it comes to pregnancy, we're working with Yale University and more than 100 physicians and experts in the United States and around the world who are specialists in pregnancy. And we have been modeling exposure to the head at the end of pregnancy. And at the end of pregnancy, when of course the head, as any woman here knows, is right at the surface, if you're lucky it's at the surface and it's not facing the spine, then you can get the greatest exposure because of course the skin is completely permeable to this radiation exposure. And that's why we've developed the Baby Safe project with colleagues at Yale to advise pregnant women to protect their abdomens